Hey everybody, thanks for joining. This is Todd Lassane. I'm PA here at Althera Alternative Care. I've had the opportunity to speak with you a bit on some of these videos that we're putting out on social media channels and just wanted to move it in a different direction this week. And I'm thrilled to announce that as a clinician, I'm stepping into my third decade of practice. This stage of my career, my approach to medicine has changed. It seems that I'm doing things a whole lot differently now, and the fact that I have my own clinics allowed me the flexibility to move in directions where my experience and my expertise is taking me. And different than when I first began, when I was practicing more to satisfy the business demands of medical practices and where I worked. Now I find myself free of those pressures and available to tap into new and emergent therapies that go beyond the standard of primary care treatments. And I'm asking myself these questions: do we really approach joint pain the same in 2025 as we did when I started practice in the late 1990s? To answer that, in my spare time, my browser is always pointed in the direction of what's new. What's available in the market, what's working, what are the pro athletes taking, frankly. How do those brothers kind of make it through and do what they do and do it at such a high level, considering all the insults to injury that they run into and that they face? What does the science show? What does the medical literature support? I'm trying to access those therapies and offer those types of treatments to persons like you and I. We're not pro athletes. Offer a new toolbox of therapies that you can't get at your regular old primary care doctor's office. And that's at least what I'm talking about today. So, in general, the future of healthcare is here. I'm excited to be at the forefront of that. And like I said, bring the latest and greatest to those that I serve. And so let's start today. And I want to talk to you a little bit about the exciting world of peptides and their potential to enhance health and wellness of all of us in our day-to-day lives. So what are peptides? Peptides are small chains of amino acids. And as you might recognize that term amino acids, building blocks of proteins. But amino acids are much, shorter in length, peptides rather, they're much shorter in length and simpler in structure compared to a typical protein found in the body. Peptides are natural in every cell and every tissue in our body, and they perform a huge number of essential biologic functions. They act as signaling molecules within the body, and they communicate between cells, or allow cells to communicate between themselves and instruct the cell on where and when and how to perform a specific action, an action like healing, like fighting off a pathogen or regulating hormones. And so unlike synthetic pharmaceutical medication, peptides are unique because they're identical biologic substances in our body. They're naturally produced in our body. And in that light, they're very well tolerated and usually more effective than some of the pharmaceuticals that we use. This biologic parity, when you've got a substance that you're taking that's similar to what your body naturally produces, it naturally results in fewer side effects. It's generally more efficacious. Scientists and the literature supports that scientists have identified thousands of different peptides within our bodies. I just want to mention that the prototypical peptide is insulin. Everybody recognizes that. So these are not things that are unknown to us in medicine, but just more replete in the literature nowadays and more available in the literature nowadays. And certainly I've got better experience with the patients that I've been seeing and the therapies that I've been offering to people. We were utilizing peptides on a regular basis to kind of, as I said before, access a different toolbox of options for patients presenting with pain in joints, for example. I don't want to say that joint pain is the only indication for the use of peptides. The role of peptides in the body is incredibly diverse. Anywhere from managing hormonal imbalance, aiding in repair and regeneration of tissues, whereas some peptides have been shown to have anti-inflammatory effects, antimicrobial effects, assist with cognitive function, weight loss, and certainly have all sorts of potential benefits and encouraging future in the direction of anti-aging therapies as well. In medicine, peptides are used therapeutically for their natural signaling abilities. They can be designed to mimic natural processes, helping the body to heal or overcome deficiencies and imbalances. And peptide therapy involves the use of specific peptides to target specific conditions. As I mentioned previously, peptides have shown promise in a wide range of health areas, included but not limited to enhanced healing, skin health, immune system support, weight management. We have peptides that are very effective to promote muscle growth and strength gains. We have peptides that can help to point in the direction of bone health and bone healing, and of course, hormone imbalance. At Althera Alternative Care, we understand that each individual's health journey is unique. We're committed to exploring how peptide therapy can be specifically tailored to address your personal health needs and your specific health goals. We just brought in our new packaging and new labeling for this particular product. This is body protecting compound BPC 157. It's a pentadecapeptide, which is a fancy way to describe its molecular configuration. This peptide is obtained from gastric acid contents, interestingly enough. It has multiple applications in medicine. Specifically, if you take this peptide orally, has great indications for decreasing inflammation in the gut. And has great indications for inflammatory bowel disorders, things like ulcerative colitis, Crohn's disease, irritable bowel syndrome. So when you take this molecule, this peptide orally, patients are seeing good improvement in some of these inflammatory bowel conditions. One of the other unique properties about body protecting compound 157 is there's a tremendous amount of literature available to suggest its indication for the use of in joint pain, as it has protective effects for ligaments and tendons and some regenerative qualities also. So we could use this thing, or this particular peptide, by introducing small amounts of the molecule subcutaneously right underneath the surface of the skin in and around a painful joint. I've got patients that are suffering from different types of ailments in the shoulder, Hill-Sachs lesion, Bankart lesion, rotator cuff injuries and such. And basically, you can inject this molecule right in and around an Achilles tendon. And over time, this is decreasing inflammation on the tendon. It's promoting pro-inflammatory mediating cells, some of the interleukins and tissue necrosis factor, prostaglandins, and bringing some of those pro-inflammatory mediators to the area there and really allowing for accelerated healing. I haven't found this study, but there was a Russian gymnast back in the Olympics that had an Achilles tendon tear at the beginning of her Olympic journey and was able to come back and compete prior to the end of the Olympics. There's another molecule called thymosin beta 4. Sometimes when you combine BPC 157 and TB 500, you've got a very potent mixture to help. It's these type of therapies that accessing here at Althera that you won't find at your routine primary care doctor's office. When we're talking about the way that patients approach, or the way that clinicians rather approach pain in joints, it's pretty rudimentary in my opinion. A patient comes in saying that they've got pain in their shoulder. I had a patient one time telling me her whole goal was that she wanted to get back to an overhand serve. She had a shoulder injury. It was subacute. From our perspective in medicine, this is something that doesn't require surgery. So if you come to a primary care doc and you're saying, hey, my shoulder's been hurting, the options for that clinician are oftentimes an anti-inflammatory via mouth, something like Tylenol and ibuprofen, of course. We might get creative and we might use a topical anti-inflammatory like diclofenac under the brand name Voltaren gel. Maybe your clinician is familiar with things like arnica or turmeric or any of these topical rubs like a tiger balm or Siberian ginseng or something like that. This really almost exhausts their toolbox of therapies that are available in primary care. The next thing that they might tell you at that primary care office is, hey, what about a course of physical therapy? Get over to the physical therapist. I started my career in physical therapy way back in the late 80s. So I have a wonderful, wonderful love for physical therapy. And I recognize that those brothers physical therapy offices are doing tremendous work. Patients benefit a lot from that. In my opinion, this doesn't have to be an either or. And I really appreciate the opportunity to bring additional therapies, such as our peptide therapies, to the healing recipe to give patients an alternative, something else in between physical therapy, non-steroidals, or discontinuation of the offending event, which basically means, hey, join the chess team for a little bit. So peptides offer another modality that we can utilize to help to accelerate tissue healing and joint recovery and repair. And I'm happy to bring those opportunities to our patients here at Althera.